Good morning. Today it gives me great pleasure to introduce Dr. Elisabet Jubert, a resident dermatologist. Good morning, Elisabet.
Good morning.
First of all, I would like you to tell me something about yourself. Tell me something about your background.
Okay, I'm from Barcelona. I have always lived in Barcelona. I'm 33 years old, and it's more or less 2 years since I arrived to Mallorca. And I feel good here in the rock.
In the rock in the middle of the Mediterranean Sea. When you finished school, were you clear about what you wanted to study? Did you have clear your ideas?
Yes, I was clear, but my parents drove me to another.
What did you want to study?
I wanted to study history or something related with arts.
And why did your parents, both your parents or your mother, your father, or why did they change your idea? What was the reason?
No, they spoke with me and they say that I have the ability or the capacity to study something more specific, and with my abilities or maybe with my character, maybe I would be a good doctor. And when I was young, I always played as a doctor with my sister.
Okay, this is very interesting. Do you think that maybe when you were younger, you wanted to be a doctor when you were younger? Or?
I don't know, but when I was 6, I always played doctors. I was the doctor and my sister was the patient and the secretary and the nurse.
Okay, very interesting. This leads me to another question, and the question is, to study medicine and to be a good doctor, is it important to have a vocation, do you think?
Yeah, I think that you need something that makes you realize that you want to be a doctor. Maybe this is the vocation, but it depends on what vocation means for you.
And what does vocation mean for you?
I mean, vocation means that I'm interested in something. I didn't study medicine to save people. At the beginning, I didn't study medicine to take care of somebody.
Why did you study medicine?
Because I was interested in the body, maybe the biology, the chemistry, and I think that the most perfect machine is the human body. So I was interested in the human body, and the only degree that was related with the body was medicine.
So do you now believe that your mother, I think it was your mother who was more influential in you studying medicine? Is that for a particular reason? Was she a doctor? Was she...
Nobody in my family is a doctor. I'm the only one, the first one, and I think that the last one maybe. But...
And would you agree now that your mother and father pushed you in the right direction? Are you happy with...
think so. I think so. Maybe when I get Jubilee, I'm sure that I will study history, art, or something. I think it's more to follow my culture, you know, not to work as a historist or I think
this is something which I always think is very important or a very interesting thing. The sciences, and especially the medical sciences, I think you cannot study by yourself. You cannot be self-taught. But history or art, you can be self-taught. So it's possible to combine the two, but to be a good doctor, you need to study medicine in the faculty, etc. And talking about faculties, where did you study? Did you study in Barcelona?
I studied in Barcelona, in the Central University in Barcelona, but not in Clinic Hospital, in Bellvitge Hospital.
And did you enjoy Bellvitge? Do you think there's a difference between Bellvitge Hospital and the Clinic Hospital?
They are in a great distance. In the clinic, there are the paupers, the teachers, you know.
The gurus.
Yeah, the gurus. And in Bellvitge, we were less people at class, so the relation with the teachers and doctors were more close. And I love the hospital. It's a very working hospital. You know, you every day you see a lot of patients, a lot of the number of patients that
it's more hands-on, more practical, less theoretical.
And I think that for a student, what you need is to see patients. more and more and more.
So you see patients from an early age as a medical student?
Yeah, depending on the university in Barcelona, in the Autónoma, they study for 5 years and the last year they go to the hospital. But in Bellvitge or in clinic, at the same time you study a topic, you go to the hospital.
And does this make you a different doctor? Does this give you a different approach?
No, because I think that what makes you a doctor is the specialty. When you are working as a doctor, you are a spectator. Maybe you are a spectator, but you need to touch. You have to take decisions, and that's when you are a doctor.
Okay, that's when you become a doctor. When you start working with patients and treating patients. Nowadays, and in the past, on the television in Spain and in other countries, there's been a lot of series about doctors.
Yep.
Are they a good portrayal of the reality?
The Spanish series, no. They're bad series.
And the American or the British?
The Americans, maybe the ER.
Yeah. Did this influence your reason to become a doctor?
No, because I was studying medicine, or maybe I was a doctor when the fashion of medical series began.
And we're talking a little bit about your studies in Bellvitge, in Barcelona University. The qualities of a good doctor. What qualities does a good doctor need to have?
First of all, empathy. I think empathy, you have to be a good listener. Because if you don't listen, you don't understand what the patient needs, and to be a good speaker, and be a very hard-working person.
You need to study a lot.
Yeah.
And a good listener is something which is acquired or something you have?
I think that you are a good listener, and you improve. You develop your capacity.
And would you say you're a good listener?
Yeah, I prefer to listen rather than to speak.
But today you're speaking fantastically, and I'm sure everybody watching will agree completely. Dermatology. You're a dermatology resident, but that wasn't your first choice. Or can you explain a little bit about your education, your medical education? Because I think you started in the intensive care unit. Is that correct?
Yeah, it is. Dermatology was one of my first options, but I didn't get a good mark during my first exam, so I had to choose another specialty depending on my mark. And after being specialist in intensive care medicine, after 2 years working as a doctor, I realized that I love to be an intensive care doctor, but
it wasn't for you.
It wasn't for me, so I study again, and I passed the exam. I get a very good mark, so I was able to get.
This seems to me, I don't know.
It was something that was in my brain, and you always think about this. I have to study again. I have to pass the exam again. But sometimes you don't feel ready, or you feel tired, or study 1 year. Give up what I'm doing now.
But it's completely different. Intensive care unit and dermatology, It's completely different. Dermatology is, I think, you can correct me if I'm incorrect, that is one of the highest, you have to get the highest marks to do dermatology.
Nowadays, yeah.
Why? Why is it?
I think that this is because it gives you a good quality of life. Not because you don't work, it's because you have the time to study. You can work in a private hospital and in a public hospital at the both time. You don't work during the weekends. Maybe you work at home, you study at home, but you don't spend 24 hours in a hospital. And I think that the people today think more about the quality of life rather than it's a mix. You must be interested in something. You must be interested in your specialty. Otherwise, you can understand it.
It's very difficult.
Yeah,
no?
it's difficult.
And dermatology, I get the impression that other specialists think of dermatology maybe as an easy option for these reasons, no? But what are the attractions of dermatology for a medical student? What would you say is the beauty of dermatology?
It's very visual. It's practice. It's visual. You can touch it. You can,
Yeah.
It's and it's interesting. It's because if you enter into the specialty, you realize that a lot of diseases start in the skin. So
Skin is the biggest organ, I think.
it's
no?
the biggest organ.
Yeah.
And I think it's interesting.
And skin, I suppose dermatology is related to a lot of other specialties.
Yeah.
No?
Yeah.
So
And
you
some-
have to work in a lot of multidisciplinary teams with other specialists. You have to work with others.
You can do it.
Yeah.
You can.
And
And we must.
And what particularly do you like the most about dermatology? What do you see your angle, your future in dermatology?
I like the connective disease, the systemic diseases, everything related with cancer, maybe. And I like the practice, the surgery also.
You're talking a lot about touching. You like touching, no?
Yeah, I like
And others?
I like to work because I think it's good to spend one day in the surgery room, one day in the consultant room.
Maybe you like to touch because in intensive care it was impossible. The intensive care is very...
You touch a lot.
You touch a lot.
Well, of course,
Yeah.
you touch a lot.
Elisabet, it's a great pleasure to speak to you, and I have one last question, and I hear that you're a very fine sportswoman. Do you have the time to practice any sports?
Yes, and I think that I practice more sport here in Mallorca rather than in Barcelona because you are very close to the mountain and it's easy for you to take the car and drive to the mountain and go to not walking or all this stuff.
Fantastic. Thank you very much. It's a
Thank you.
pleasure.
It's great.